So let's talk a little bit about astigmatism. Now, astigmatism means that your particular eye is no longer round or shaped like a basketball, but it's a little bit oval or a little bit football shaped, if you will. Now, everybody has some degree of astigmatism. Some have a very small amount, and some have very large amounts of astigmatism. Now, if you can imagine looking through a magnifying glass that's perfectly round, you're going to get a nice clear image. But if that magnifying lens were actually oval shaped, you're probably not going to see all the things that you'd like to see. Things might be a little bit distorted, or you'd have shadows on letters. It's not going to be a clear picture. The analogy I make is that its eyes and eyesight are kind of like shoes and shoe sizes. Shoes come in a 6, 6.5, 7, 7.5. Lens implants come in a 6, 7, 8. And when we do cataract surgery, we can usually fit your shoe size pretty close overall to where you're pretty comfortable. Astigmatism, however, is another variable that does add a degree of complexity to correcting your vision. And that's kind of like if you needed a size 7 shoe and we gave you a size 7 lens and I gave you a size 7 lens. But if you have an astigmatism, that would mean like I gave you a size 7 lens, narrow, and you needed an actual wide. So certain aspects of it, yes, we can correct most of it, but it's not going to be perfectly comfortable, and certain things are still going to need correction. Now, astigmatism can be corrected in many different ways, for low amounts versus high amounts. And you're going to want to talk to your doctor about which type of astigmatism correction works best for you. That can be either with laser, or we can use custom order astigmatism correcting lenses that we call toric lenses. And all that depends pretty much on how your particular case and what your particular situation is. Definitely worth talking about with your doctor.